Okay. Hi, everyone. For those who don't know me, my name is Christina Clark O'Karmas. My pronouns are she, her, and I am the executive director at the Alabama Campaign for Adolescent Sexual Health. This is our monthly webinar, which we mostly do on the second Tuesday of every month. I guess we've had a few here or there that maybe haven't been on the second Tuesday, but we started this back during the pandemic as a way to engage our audience. I guess we're still in the pandemic, but we wanted to keep this going and keep this accessible for folks. We have been really fortunate to have some great guest speakers come in and talk about things that are related to sexual health and adolescent sexual health. And today will be no different. Today we have Barbara Schuler from VAX2STOPCANCER, which is an organization that focuses on the HPV vaccine and HPV cancers. And so we're so excited to have her today. We have a small audience, but I'm excited for anybody else who is able to come in. If you want to pop your friend a text and have them come in. Oh, we have another person right here. And we will have this available, this recording available after the fact as well, if you want to share with anybody who wasn't able to be here. So with that, Barbara, if you want to take it away.
I will. Thank you for having me today. I am going to talk about human papillomavirus. I'm going to talk about the HPV vaccine, and I'm going to talk a little bit about VAX2STOPCANCER and the work we're doing in Alabama. I am a cancer survivor, and after I had my cancer, I have a master's in public health. I got very interested in cancer prevention. And after doing a lot of research, found out that HPV cancers can be prevented. I have no financial relationships to disclose with any commercial interest. And the following are the organizations, foundations that support us. We started and are continue to be funded by Blue Cross Blue Shield of Alabama. The Prevent Cancer Foundation was a national grant that we got our first year. The Daniel Foundation is in Birmingham, so is the Susan Mott Webb Charitable Trust, Robert R. Meyer Foundation, Independent Presbyterian Church, and the Hugh Call Foundation. We also have funding from Alabama Power Company, Community Foundation of Northeast Alabama, and the Community Foundation of Greater Birmingham. So we are, as I said, a new organization. We were established in 2020, January 2020, right before COVID started, established by survivors, advocates, and public health experts. Our mission is to prevent cancer by expanding the use of the human papillomavirus, which is known as the HPV vaccine, through education and public awareness and increasing research of HPV-associated cancers. Our vision is to eliminate these cancers in our state through education and advocacy, reducing the high social, emotional, economic, and medical costs associated with this disease. Our state will serve as a model to the rest of the nation, bringing our cancer rates from the top 10 to the lower tier. We're endorsed by the Alabama chapter of the American Academy of Pediatrics, the Alabama Comprehensive Cancer Control Coalition, the Alabama Adolescent and Adult Vaccine Task Force, the Alabama Department of Public Health, the Immunization Division, USA Health Mitchell Cancer Institute in Mobile, and we're members of the National HPV Vaccination Roundtable and Ask About HPV, which is an international papillomavirus society. What is human papillomavirus, HPV? It's a very common infection. It's as common as a common cold, but the problem is you don't really have any symptoms. HPV infection is spread through intimate skin-to-skin contact. Most people think it's the actual act of sex, which is not necessarily true. Most people will be infected with at least one type of HPV infection in their lifetime. There are over 100 different Infections, 80 million Americans are currently infected. If you think about it, it's been a few years since we've had the flu, bad case of the flu, but before COVID, I think the last year before COVID was 50 million cases of the flu. Well, this is 80 million Americans are currently infected. 14 million new cases each year. It's most common in people in their teens and early 20s. Most infections are asymptomatic, like I said, and resolve in 2 years. Persistent HPV infection, though, can lead to multiple types of cancer. So it can remain in your body for decades. Right now, 1 in 4 men are currently infected with cancer causing HPV, and 1 in 5 women are currently infected with cancer causing HPV. HPV cancers account for 5% of all cancers. Every 20 minutes, someone is diagnosed with an HPV cancer. 36,500 HPV-associated cancers occur in the U.S. each year, which could have been prevented. 200,000 precancers each year, which could have been prevented. HPV can be dormant for decades and then reactivate. Okay, so HPV causes 6 different types of cancer for females. It is vaginal cancer, vulva, anal, cervical, and oral pharynx, or it's called oral pharyngeal, okay, which is the back of the mouth, the back of the tongue, and the back of the throat. For men, it's penile cancer, anal, and oral pharynx or oral pharyngeal. It's alarming if you look at this, the incidence of oral pharyngeal cancers down here, especially for men, have tripled in recent years. New cases are now more than common than cervical cancer, which used to be the #1 HPV-associated cancer. Each year, it causes thousands of genital warts. So, like I said, that's the most well-known, that's the most common. And let me move my screen. 2/3 of all HPV cancers are from cervical and oral pharyngeal. Well, for some reason, my screen does not want to go to the next slide. There you go. Okay. So I talked a little bit just a second ago about HPV-related oral pharynx or oral pharyngeal cancer. As you can see, it's at the back of the tonsils and at the base of the tongue. And over the last years, you can see how it has skyrocketed. Men are twice as likely as women to be diagnosed with oral pharynx cancer. There's no standardized screening test. There's no screening test for any of these except for cervical cancer. It cannot be diagnosed by a dentist, but it can be screened, but a dentist can screen for it. And that's going to be one of our next programs, is teaching dentists to make sure they are screening their patients for it. It's often found at stage 2 or higher. Symptoms include persistent sore throat, lump in the neck, difficulty swallowing, difficulty speaking or swallowing.
Barbara, I just have a quick question. Sorry.
Yeah.
So I have never thought about this before, but what is the difference between screening and diagnosing?
Well, I'm not exactly sure. So screening for it, they're going to be palpitating the neck, looking in the mouth.
Would they ask risk questions about their risk behaviors maybe?
Probably.
Would that be part of the screening process? Okay.
Yeah.
I just never considered that, one being different from the other. So okay.
You're right. And one thing that some dentists have been trained and are asking their patients if they've had the vaccine.
Okay.
And we'll talk about, when the ages that it's given and how It can be given all the way up to 45. But usually an ENT will be one that diagnoses it.
Okay. All right. I was just curious. Thank you.
It is, so the most common treatment is chemo and radiation. It's a pretty brutal treatment. It's highly curable though, significant weight loss requiring a feeding tube. When they radiate this area, your saliva glands are pretty much all dried up. Extensive side effects and lifelong problems related to the radiation of the oral pharynx and the neck. Cervical cancer. So this year, the American Cancer Society's estimate of cervical cancer in the US is about 14,100 new cases of invasive cervical cancer to be diagnosed. About 4,280 women will die from cervical cancer. I mean, this is just crazy. It doesn't have to happen because the HPV vaccine can prevent over 90% of these cancers. I'm going to talk about it a little bit later, but our state is number 4 in the nation for cervical cancer deaths, 6 for cervical cancer incidents. All women are at risk for cervical cancer. It occurs most often in women over the age of 30. HPV is the main cause. So I've seen numerous figures. I've seen 93%, I've seen 99% of all cervical cancers are from HPV. Other risks include smoking, having HIV or another condition that makes it hard for your body to fight off health problems, using birth control pills for 5 or more years, having given birth to 3 or more children. There are 2 tests, like I said, there are tests for this particular HPV-associated cancer that can help prevent cervical cancer and find it early. Pap test or the Pap smear, which is looking for precancers, changes in the cervix, which can be treated so that the cervical cancer is prevented. And the HPV test looks for HPV, the virus that can cause precancerous cell changes in cervical cancer. Early on, there may not be any signs or symptoms, but advanced cervical cancer can cause bleeding or discharge from the vagina that is not normal for you. When should I get tested for cervical cancer? The Pap test is for all women age 21 to 29 years old. If the results are normal, you'll wait for 3 years. Oh, what is wrong with my screen? There you go. 30 years old or older, the Pap test or an HPV test or both. If the results are normal, you can wait 5 years. The HPV test is also used for unclear Pap results. So women aged 21 to 65 will continue getting a Pap and or HPV test as directed by their doctor. It may not need a Pap or HPV test if you're older than 65 with a normal Pap or HPV test for several years. Cervix has been removed as part of you may not need the Pap or HPV test if your cervix has been removed as part of a total hysterectomy for non-cancerous conditions. All right, so there are lots of, hang on just a minute, I don't feel like this is right. I'm gonna get out of this for just a minute. Okay, I guess we're okay. All right, so there are notable HPV-associated cancer disparities in the US. So HPV-associated cancers in general, the highest incidence is in Black women. Asian and Pacific Islander men have the lowest incidence rates. Adults of nearly all ages are affected. but older populations tend to be disproportionately impacted. Age has a big impact on survival rates in general. The younger the diagnosis, the more likely you are to survive. Now, oropharyngeal cancer, which we talked about, is the most prominent of the HPV cancers. White individuals are at much higher incidence rates compared to other groups. White non-Hispanic men have the highest incidence of any race, ethnicity, or sex. 5-year survival rate of 53.5% for white individuals and 32.4% for Black individuals. So it's much lower. Overwhelmingly affects a slightly older population, adults age 50 to 80. So this is one of those cancers that I said earlier, it can remain in your body for decades, and it tends to come out later in life. Cervical cancer, the highest incident rates are within Hispanic women. The highest mortality rates are in Black women. Women between the age of 30 and 60 have the highest incidence rates. And there's a 5-year survival rate of 82% with a diagnosis before age 40, 52% after age 60, even considering the stage of diagnosis. And even with late stage diagnosis, 48% of those women will survive under 40 and 30% of those over 60. Y'all stop me if you have any questions. I tend to just keep going. All right, I'm going to play this video for you. I have played this video probably 100 times, and every time I play it, I get goosebumps.
My name is Lisa Moore. I'm 30 years old and I live in South Bend, Indiana, and I was diagnosed with stage 1B1 adenocarcinoma of the cervix at 26. No one deserves this. Bowel obstructions are not fun. Meth tubes are not fun. Tubes in your stomach aren't fun. The side effects of the treatment are not fun. If something like this is preventable, I don't understand why people don't want to prevent it. If you have a leukemia vaccine or breast cancer or prostate cancer or anything not related to sex, there'd be no question. The cancer sucks. It takes and takes and takes. And majority of the time, it takes everything and kills you. If I can help somebody else not go through this, it's probably the best thing I have to offer at this point.
So as, So as you can see, there are real consequences to this, to cervical cancer, the HPV related cervical cancer, and she dies from it. It was diagnosed at 26, could have been prevented. So she reminds us that the HPV vaccine is cancer prevention. Okay, y'all.
My name is Lisa.
Hang on.
Lisa Moore.
I don't understand why it's doing this. There we go. Okay. HPV vaccine, as I just said, is cancer prevention. Think about it, cancer prevention. How many cancer preventative vaccines do we have? Well, we have hepatitis B that is given to infants, but we don't have anything else. And as she said, if this was for breast cancer, if this were prostate cancer, parents would have their kids lined up around the block. People would get it in masses, but because it has to do with intimate skin-to-skin contact, it's just harder for people to accept it. So it is safe protection. It offers protection against over 90% of HPV associated cancers. Over 270 million doses have been delivered in the world. Over 120 million doses in the US. 109 studies of 2.5 million people. Over 15 years of HPV vaccination safety data. And the only adverse effects are the same that are seen in any other adolescent vaccines: pain, redness, swelling, dizziness, muscle aches, and fainting, which teenagers do when they get their vaccines. They tend to faint. Okay. HPV vaccination recommendations. On time is age 9 to 12, 2 doses. It's especially effective in younger adolescents. It is for all adolescents, both male and female. The virus doesn't care if you're a male or female. It's considered late at age 13 to 14, but it is still 2 doses. However, if age 15 up to 26 plus, goes up to 3 doses. So it's recommended up from 9 to 26, but in 2019, the FDA approved it up to age 45, but recommends that you talk to your physician about it because it is, most people have had more exposure. My kids got it because they missed it, and they've gotten it in their 30s. So giving it at a younger age is twice as effective at protecting against cervical precancers. Younger adolescents have a better immune response to the vaccine, and they're less likely, the younger they are, to have been exposed to the vaccine, to HPV. Okay, and you can see by this, the impact that HPV vaccination has had is a sharp decline. The bottom one is 18 to 20, and the top one is age 21, 24. In cervical precancers, in screened young women, a 54% decrease. There has been a historic HPV vaccination impact. This was last year. The United Kingdom had a study in Lancet, which is a medical journal, which showed that the vaccine reduced cervical cancer rates by 87% in women who were vaccinated at age 12 and 13. This was a big deal. And it was, I don't know when to do it yet. Anyway, it was published in the Lancet. So it compared adolescents who were vaccinated at age 12 and 13 and those who were not vaccinated. And the ones who were vaccinated had an 87% lowered chance of getting the HPV. And I'm going to play this for you.
For the first time, we are seeing real-world evidence of how well one HPV vaccine can prevent one of the most common cancers in women. Researchers are calling these results historic. More than 90% of cervical cancers are caused by HPV. The UK study shows an 87% decrease, that's right, decrease in the rate of cervical cancer in women who are vaccinated against HPV between the ages of 12 and 13. That's compared to an unvaccinated group. The research was published in The Lancet. The CBS News chief medical correspondent, that's Dr. John LaPook, joins us now at the table. John, it's so good to see you because I know you've been talking about this for a very, very long time. I'm curious about what your reaction was when you heard this news. Seems like a very big deal.
It is. This was great news. This was one of the very first stories I did back in 2006 when I first came to CBS News, was the FDA approval of this vaccine. At that point, it was a hypothesis. We knew that more than 90% of cervical cancers are caused by the HPV virus. And the question is, well, okay, it makes sense. If you prevent that infection, you should prevent cervical cancer. But we didn't know it was a hypothesis. Now we know absolutely it does.
And I remember it was controversial at the time. There was a big discussion around whether or not it should be given and what age. And now the recommendation is for girls as young as 9.
Yeah.
Why start so early?
And that does seem very early.
Seems very young.
Very good question. There are 2 very good reasons. One is, this is not a treatment, it's a prevention. It only works if you prevent it. So of course you want to give the vaccine before somebody can be sexually active. The other one that's not so intuitively obvious is that when you give it at a younger age, it actually works better. It elicits a stronger immune response. So those are the 2 issues.
Okay, but as a parent of a daughter who is 11 years old, I'm thinking to myself, well, this is an infection that she might not get. So why should I give my daughter this HPV vaccine?
You may think she may not get it, but about more than 85% of Americans who are sexually active get it. It's a very common, easily transmitted infection, right?
It's out there.
It's not
everywhere.
just, and it's not just girls, it's boys too. So this is now.
Boys aren't in this conversation though.
Well, that's what I
Should
was
they be?
about. I was gonna drag them in
You were?
myself.
Oh,
Right.
yeah.
Absolutely.
Should they
So
be?
I
Oh,
had
should
both.
boys get it?
Yes, it's recommended for boys. Boys not only can give it to the girls, so just as an ethical reason to try to reduce it and prevent that
Right.
the mode of transportation of infection,
Right.
but also guys can actually get infected themselves and develop these cancers. Guys can get cancer of the throat, of the tongue, of the genitals, of the anus, and those areas of the body can also happen. You can get cancers there in men and in women.
Wow.
So finally, we have all these vaccines, talk of vaccines that can prevent all these deadly childhood illnesses. We have a vaccine that can prevent cancer.
You just mentioned the word sexually active. Does it apply if you're sexually active? Is that what you're talking about?
Well, the way this is spread is through sexual activity, and it's actually in the skin. So, if you wear a condom, it can give you some protection, but it's actually skin to skin condom. So it doesn't give you perfect protection. That's why it's so easy to spread it. And it can be spread by all sorts of sexual routes.
But that's why when you hear a 9-year-old girl's getting it, you just don't think of 9-year-olds
Exactly.
sexually active.
They're
That's
not
right.
sexually
Make
active,
the-
but you got to give them
make
the
the
protection.
connection.
It's a
Okay.
preventative,
Or they
Got
are
it.
sexually active because
Okay, got
you're
it.
preventing it. So
preventative measure.
once they get the
Got it.
infection, it's not a treatment. You have to give them the vaccine so that when they get exposed, they then don't develop the infection.
I guess that also explains the 13-year lag between when the shot was initially given and then these results. They're out of the UK. Is there a similar study coming here in this country?
We've had little studies that have suggested this is the biggest one, and it's really great to see that finally we have the data to say this works, and it's not probably going to work just for cervical cancer, but for the other cancers that I mentioned that are also associated with HPV.
It's still a voluntary thing at the moment.
It's voluntary.
But you're endorsing it.
All right.
I totally
Whoops.
endorse it.
All right.
He said, I totally endorse it.
All right. Dr. John LaPoop, thank you.
All right, let's see if I can get to my next one. All right. So there are gaps in vaccination coverage in the US. Socioeconomic status, this is really interesting. Adolescents living at or above the poverty level have a much lower HPV vaccination rate than those living in poverty. 41.7% of teens living at or above the poverty level were up to date. 50% of those living below the poverty level were up to date. So race and ethnicity, non-Hispanic white teens had a much lower vaccination rate for the vaccination rate for HPV than those of other ethnicities. At just 39.6%, the HPV vaccination rate among whites in 2016 was more than 10% points lower than Hispanics. The location, people living in large cities had much higher vaccination rates than those living in the rural areas. Only a third of the teens living in the rural areas communities have been fully vaccinated against HPV. Nearly half of those living in a large city. And then the graphic location, northeastern states like Maine and Rhode Island, they have the highest vaccination rates. I sometimes wonder if it's because I don't know, a lot of the pharmaceutical companies are up there, but maybe I think the political beliefs are probably different. Southern states like Mississippi and Alabama had some of the lowest. All right, on this one, it shows some of the gaps what we just talked about. So the gaps in HPV vaccination coverage could provide early information how disparities in HPV-related cancers might shift in the coming decades. So the Black is Native American and Alaska natives. Asian have the highest. Hispanic is in the yellow, and whites are at the bottom. So vaccination coverage has remained relatively low for years. Only 43% of US teens, this is ages 13 to 17. This is a higher age than what we look at. I'm going to talk about our program. We're up to date on the vaccine in 2016, but rates varied widely throughout the country. And as I said, disparities in HPV vaccination coverage are reported for a variety of reasons, including income, race, ethnicity, and where they live, which we just talked about. HPV-associated cancers by state, you can see that in the Southeast, there are very high rates of HPV-associated cancers, and it's no different in our state. And they're much higher than they are for the national average. The HPV vaccine can reduce these rates. All right, this is a national study looking at age 13 through 17. The interesting thing is, if you look at Tdap and meningococcal vaccines for practices that give this at 11, they get all three of these vaccines at 11. Look at the difference between those two vaccines and then the HPV vaccine. It's much lower. And so right there, there's a missed opportunity to give this vaccine. They're getting the Tdap and the meningococcal vaccine. Alabama is in the blue and the US is in the orange. So it's a big difference. So that's a national study. This is a study by the Alabama Adolescent Vaccine Task Force, which was from ADPH. And it shows that again, you can see the differences, but the uptake in 2020, this is for 11 to 15-year-olds, was 44%, but there's more than one shot. So the completion rate, you need either 2 or 3 doses. The completion rate was only 22%. Very low. And so you compare that to the 71% of Tdap and 59% of meningococcal.
Barbara, is there any benefits to even just having one dose of the HPV? So like there's a big difference.
There is.
Okay.
There is, but completion rate is much more effective of getting that 90%.
Right.
Protection.
Of course, yeah. But I was just curious if at least for that 44% or
they
that
do
22% gap, that at least they had some protection.
They do get some protection.
Okay.
So this is from the Alabama Department of Public Health. So the real number for these for these national, for Alabama, is somewhere between what ADPH says and what the national rates put it at. But this was in 2019, we were at around 22%. It's dropped much lower than that because of COVID. But looking at, we're number 4 for cervical cancer mortality, number 6 for cervical cancer incidence. This is in the US. Number 4 for, actually, this needs to be updated. We're number 3 now for oropharyngeal cancer mortality and number 12 for oropharyngeal cancer incidence. So, all of those can be prevented if we can just get people vaccinated. Parents' reasons for not getting their child vaccinated. They don't think they need it. I hear this from pediatricians and family practice physicians all the time. My child's not going to do anything until they're married, which we know is probably not true. And even if they do have any, don't have any kind of intimate skin-to-skin contact, whoever they marry is going to probably already have it. Safety concerns. There's so many myths out there about the safety of this vaccine. It's one of the most studied vaccines that there is. No provider recommendation. Sometimes a provider is not comfortable recommending this vaccine because he's scared it's going to be talked about. The topic of sex is going to come up. Low knowledge. Some parents don't know it's for boys also. My child's not having sex. Well, perfect opportunity to give the vaccine before there is any exposures. But each one of these can be addressed by a provider. And not getting their child vaccinated for each of the reasons right there. But when we train providers, we train them on what to say to parents to help answer their questions. A provider's recommendation that are powerful. Now, right here, this was a study of 20,000 kids. 47% of the kids got the vaccine with no recommendation, not a great number. But when a provider recommends it, 75% of the kids got it. Provider's recommendation is extremely important. Research shows it's more important than the parents' vaccination beliefs, their ethnicity, or their education. We have a provider education program where we go out and we train pediatric and family practice providers in private practice, health departments, fairly qualified health centers, and rural health centers on how to effectively recommend this vaccine. We educate them on what to say to parents who hesitate to vaccinate their child, and we use a program out of University of North Carolina Gilling School of Global Public Health to answer those questions, and how to recommend it is called the announcement approach. We provide them with strategies to decrease their missed opportunities to give the vaccine. Our goal is to raise the HPV vaccination rate in their practices and in the whole state by 10%. We have a 1-hour training with a core team for the practice where we show them what their HPV vaccination rate is at that present time, and we work with the Alabama Department of Public Health to get those numbers. We train them, like I said, on how to educate parents, how to recommend it, and then teach them strategies to decrease those missed opportunities. All they do after the 1-hour training is every time they give the vaccine, they put it in imprint, which is the state registry for vaccines. And then at 3, 6, and 9 months, it turns into a quality improvement study. And at 3, 6, and 9 months, we give them what their data is, hoping that their rates are increasing and they'll meet their goal of raising their rates by 10%. We encourage and recommend starting the vaccine series at 9. CDC says 11 to 12 can be given it started at age 9. Now, the American Academy of Pediatrics, the American Cancer Society, the National HPV Vaccination Roundtable all suggest starting it at age 9. It's a better completion rate by 13. And as if you remember, I said by 13, it's late. And that's one less vaccine they have to have when they turn 11. So since 2020, we've trained 38 sites, 165 healthcare providers and staff, and it's in 18 Alabama counties. Our 12-month results show an average of 11%. So right now we're above our goal in 9 to 13-year-olds who are up to date on the HPV vaccine. And then we've seen the confidence in these providers of recommending the vaccine that is increased after the training. So here, this shows on the left, responses by trainees to the statement, I feel confident in recommending the HPV vaccine. So pre-training surveys showed that 32% strongly agree that they felt confident. So it's a 42.73% response. Now on the right, after the training, it showed that they strongly agreed that they felt confident to a 65.52%. Pre-training agreed they felt confident, it was 21, almost 0.9%. I'm just going to round it up. And then those that agreed after the training went up to 29%. Neither agreed nor disagreed before training was 10%. And then neither agreed nor disagreed went down to 5%. Those that disagreed that they felt confident and they didn't feel confident in recommending it was 6.36 pre-training. After the training, none of them felt, they weren't confident, didn't feel confident. And then strongly disagree was 19% pre-training, and post-training was 0%. So this vaccine has been out for so long, and providers have had so much pushback from parents that they just, they'll say it, but what we're trying to do is shake the bushes and remind them the importance of this, and that they need to recommend it and recommend it strongly. So they've had a lot of pushback from parents on this vaccine.
Have they said, or did they say in that survey if they neither agreed nor disagreed, why after the training they felt that way?
I think that sometimes, no, but I'm thinking myself, because before I started this, I worked with the state, with ADPH and the Alabama chapter of the American Academy of Pediatrics, doing the same work before I started this nonprofit. And they all think their rates are very high, and they don't like us showing them rates that are not what they expected. So some of them, the training sometimes can be a little offensive to them. So sometimes they just don't really want to be told another way.
They're offended at the implication that they aren't doing what they need to be doing.
Right.
Okay.
But also, the only data that they have seen is the data from 11 to 13.
Okay.
And we're trying to get the state health department to give them the data starting at 9, because then we come in and show them only 9 to 13-year-old data. And so the rates are very low.
Yeah. Okay.
And they're not used to seeing them that low.
Yeah. Okay. Okay.
So we have a public awareness campaign. We have a comprehensive digital and social media campaign on Instagram, Twitter, and Facebook. Our campaigns target parents, adolescents, and the general public about the messaging about safety, efficacy, and the importance of this vaccine. We provide accurate information to dispel the myths from the anti-vaxxers about the vaccine, especially on the safety of the vaccine. So there are over 500 anti-vaxxer websites that are put misinformation out there, like the vaccine causes cancer, or the vaccine can make your child sterile, your daughter sterile. Well, no, what can make the daughter sterile is having cervical cancer and the treatment for it. And we have reached over the past year 577,000 people with our campaign. Now, COVID has had a terrible impact on this vaccine and all other vaccines too, but the HPV vaccination in adolescent rates fell by 75%. The state health department right now says our rates are at about 17%, which is extremely low. Since March of 2020, 1 million doses of the vaccine had been missed by adolescents and public insurance, a decline of 21% over pre-pandemic levels, which were already low. Remember, we talked about the difference between those other vaccines and the HPV vaccine. So this was, I think, spring of last year. All 71 NCI designated cancer centers made a national call to action to healthcare centers, physicians, parents, children, young adults, to get everybody back on track with this vaccine. And that's all I've got. But we'd love for anybody to sign up for our newsletter. Please, like us and on Facebook, Instagram, Twitter, and LinkedIn. And there's info at VAX2STOPCANCER. I'll be happy, send me any questions, and I'm happy to answer questions now.
Yeah, you might want to put your contact page up just one more time so that folks can write things down or whatever. Click on the link. Thank you, Barbara. This is so informative.
Wait a minute, what's my problem here? There you go.
We're almost there. I think
I wonder if I can just put this in the chat. I'll try.
that's probably really helpful too. Yeah.
I'll try.
Yeah, lots of great info. Vanessa just said that, great presentation. I feel like every time I hear about HPV, I learn something new.
There you go.
I mean, the rates are alarming, and I'm so glad that y'all are doing the work that you're doing to train physicians on how to make those recommendations. Are there any questions for anyone? You can drop them in the chat, or you can come off of mute.
I think we just all forget this is cancer prevention. Why would you not give this to your child?
Right. And for those of us who work in sexual health, we totally feel that pain, because it's like we feel like this information is so common sense. Even if your young person isn't having sex now, they will eventually. They need the tools to protect themselves.
Right.
And there's just so much pushback in the southern United States.
Because the vaccine is given at such, recommended at such an early age, those providers do not see what can happen later in life when somebody's an adult. And we really say that to them. We say, it's your responsibility to protect your patients from these cancers that you're probably never going to know they even had.
Yeah.
But it's, it's the opportunity is with you and the responsibility.
Absolutely. Absolutely. Well, thank you so much, Barbara. I'm going to also drop in our evaluation form in the chat. If y'all who are here will just click on that, it'll take you to a Google form, and you'll just fill that out so that I can know how to make these better. I can learn what you all want to learn more about. And again, we have about 10 minutes left, so we'll just leave it open for a couple minutes and see if there's any questions. I don't want to cut anybody short. All right, well, I'm not hearing anything. Again, please click on that form and fill out that evaluation. That's so helpful for us. Please visit, they are everywhere: Facebook, Instagram, Twitter, LinkedIn, VAX2STOPCANCER. That's so awesome that you have the same username for all of those. I am envious. So that's easy to find. And
if you know anybody who has young children, make sure they've been vaccinated. And again, it's recommended all the way up to age 26, and then 27 to 45, talk to your physician about it first to see if it's depending on your exposure, et cetera. It may not, but my kids got it in their 30s. So I didn't know anything about it when they were young and they'd gone to college. So
yeah. And I remember getting at least the first one, but I really struggled to know if I got all of them. I was a military kid, and so we moved around a lot, and I just have no recollection past the first one of getting it. I do remember when it came out. I was still in high school, I think, and then I was in college. So
you can still get it.
Yeah. All right. Well, thank you so much, Barbara. And we will hopefully hear from you at some point in the future.
All right. Thank you.
Have a good one, y'all.
Bye-bye.